The Boise State Public Radio app. News, music, and more.
Idaho Matters.
Morning Edition.
All things considered.
The Connector.
And more.
And more.
You can take us wherever you go and stay connected. Without it, you're missing out. Download it free.
You can also communicate using the Talk to Us tab.
The Boise State Public Radio app.
From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Gemma Goddard. It's Idaho Matters. We are in the middle of Idaho's deadliest flu season since 2018. Plus, energy drinks and caffeine can be a very deadly mix. And just where is Gemma Goddard? It's Wednesday, time for our Doctor Roundtable with Dr. David Pate. He's the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Dr. Pate, once again, thank you so much for being here.
My pleasure, Samantha.
Well, it's going to be a very interesting show. We're going to be with you for the entire program today. And I want to start with the flu. We got some recent numbers from the Idaho Department of Health and Welfare. And quite frankly, I was a little shocked. 73 people in Idaho have died so far this season from the flu. It's the worst time, worst we've seen since 2018. That's when 98 people died. What's going on?
Well, and you may recall that over the summer, when I was talking with Gemma about the upcoming flu season, I anticipated it was going to be a bad one, not because I have any particularly brilliant insight, but I just looked to see what was happening in Australia. Australia is often a good foreteller of what we can expect, and they had their worst flu season in over a decade because they had their flu season during our summer. And so I was able to see that it was likely going to be a rough ride for the United States, and it has turned out to be the case.
Wow. It's kind of scary. 73 people in Idaho died from flu-related causes, and the season's not over. Is it? Is the season over? And if it's not, we could break that record from 2018.
Yes, I'm worried about it. The deaths always lag, and we'll get reports of more flu deaths, no doubt, over the upcoming months. And it's going to be bad. And I think particularly tragic are the children and young people that have died, as there's an impression that these are all very sickly kids or something. Half of them are, as far as anybody knew, perfectly healthy.
Oh.
And so these are very tragic losses. But influenza does this and can do this, and it gets underestimated. In answer to your question, are we at the end? We're close. I think we're within a week or several weeks of it being pronounced over. Now, even when it's pronounced over, that doesn't mean you can't get the flu. We continue to have very low levels of influenza infections throughout the year. It's just that a lot of times we don't recognize it because we don't look for it when it's not very common. The way we define when the flu season is over is when the percentage of influenza-like illnesses, which mean people with fevers and coughs and sore throats, seeking care in urgent care and doctor's offices falls below 3% of all the people seeking visits, as well as looking at what's happening with hospitalizations. The deaths are considered, but that's a late indicator. As I said, we'll see more reports of deaths even once the season is pronounced over. And this will be a bad one, and that's tragic. And it can be for all kinds of reasons, but it's often related to whether we have a strain that has not been circulating for a while or that people haven't seen for a while. And this is why we can see deaths in young people that are perfectly healthy, because they haven't been around enough to see some of these strains. And I would tell you, we should brace ourselves for next year, because what I'm already seeing as we are ending and Australia's beginning, it looks like it could well again be a bad season. But I'll know more in a few months and be able to indicate how it's going in Australia.
Well, and we've talked a little bit about this before, that the flu is not a cold. It's different. And as we're seeing deadly, I remember the first time I got the flu officially, because, you get colds your whole life. And then one day I was really, really sick, and I went and I got diagnosed with the flu, the actual flu. And it was like night and day. It was totally different than a cold.
Absolutely. And when I was seeing patients, there were questions I would ask that would help me tell the difference. Plus, when I was in training and I was staffing the emergency room, I remember in my early 20s getting influenza, and I, just like you, it's not like any cold I had. And so, tip-offs when I'm questioning people, first of all, degree of fever. Not everybody with the flu has higher fever, like 102 or so, but few people with just routine colds have that high of fever. So that can be an indicator. The other thing is colds usually creep up on you. The influenza is like people will tell me at 1:42 p.m. I got this or that. I mean, it hits you so hard. Another thing is just very typical with influenza for people to describe really significant muscle aching. In fact, even sometimes involving the muscles around the eyes. So people will tell me it hurts to move my eyes. And those are all kind of clues that we're dealing with something more than the flu. But more than the cold, but why people die with flu. First of all, the flu itself can do it. But a lot of times what happens is people either get co-infections. For example, we know you can get COVID and flu, and they might just test for the flu and not for COVID and not realize it's there. But we know outcomes are worse if you get co-infected. Another thing is that once you get the flu infection, it makes you more vulnerable to a bacterial, what we call superinfection, meaning that the virus has already kind of made your airways raw, and then you can get a bacteria comes in, follows on its coattails. And in fact, a dear friend of my wife's decades ago died from that after she appeared to be getting over the flu. Then she got a bacterial pneumonia and died. So that is something we're always on the lookout for as well. And a lot of people don't understand that for older people, after the flu, in the next month, your risk for heart attacks and strokes goes up too.
Oh, wow. Really? That's amazing.
So, yeah, it's underestimated.
I got to say, and sorry for anybody eating lunch right now, when I first got the flu for the first time, I puked for a week. I could not keep anything down. I just could not stop throwing up. And so, it's just one of those things. The symptoms are more intense. And as you said, there are more of them. So, if you think you got the flu, definitely get checked out.
Well, and the good thing about once you've had the flu is it tends to make selling flu vaccines much easier after that, because no one wants to go through that misery again.
I have gotten a flu vaccine ever since, I will admit.
Me as well.
Dr. Pate, you may have noticed that I am not Gemma Gaudet. I don't know if you noticed that.
That it did occur to me.
A lot of people have actually noticed this. In fact, we haven't heard from Gemma for more than a week, and we wanted to talk about that today. So here we go. Turns out 2 weekends ago, so not last weekend, the one before, she was feeling some pain and discomfort in her side. She thought it was probably her menstrual cycle, and she wasn't too worried. And then the pain got worse. She ended up in the ER with appendicitis, and it was so bad she had to have emergency surgery that Sunday night. So first, I want to say Gemma asked us to talk about this today. She thought it might help someone in the future. She gave me permission to say all this, so I'm not violating anything, like HIPAA. So let's dive in. First, what is appendicitis, Dr. Pate? We see it a lot in TV and movies where people get it and, I have to go to the hospital. But what is it? What actually is appendicitis?
So your appendix is located where your small intestine hooks into your large intestine. Some people will know the name of the large intestine by the more medical term colon. And so right near where those two meet hangs the appendix. And the appendix is kind of like a little finger-like projection off of the colon's wall, and it's got a hollow inside. And when it gets blocked up or the blood supply gets compromised, then you can get appendicitis, which literally means inflammation of the appendix. And when that happens, you will typically get pain. In some people, they'll feel it. If you were to just look at yourself, your own abdomen, and you just drew a line from your sternum down to your pelvis, and then a horizontal one through your belly button, it would divide your belly into what we call quadrants. And the one and the lower part on your right hand side, that would be the right lower quadrant, and that's typically where people get pain. Other people get pain starts around their belly button, and then it will tend to move down towards that right lower quadrant. The tricky part is if you're pregnant and you're far along in your pregnancy, that pushes stuff around. So typically, pregnant women will feel that appendicitis up higher. But appendicitis is literally the inflammation of it. And if it's not treated soon, then the risk is that the appendix can literally burst.
Ooh.
And then you've got worse problems.
Well, it used to be when you got appendicitis, you had to have your appendix removed and you were done. But now can't they sometimes treat it with antibiotics so you don't have to have surgery?
Sometimes that's correct. Once it's burst, no, we can't. Now you're having surgery for sure. So it has to be an assessment made as to what the risks are of the appendix bursting. If you're pretty far along, then we're going to operate. If it looks like we caught it early and we can look at on the scan to see how inflamed the appendix is, how swollen it is, that kind of thing. In some cases, we can make a determination that, we can try antibiotics. Sometimes they work and you've been saved the surgery. Sometimes it still has to result in surgery. But yes, antibiotics have now become an option when it's caught early.
Well, and you and Jim had talked about that because that's what happened to Jim's son. He got appendicitis, but he didn't have to have surgery. He was able to just get the antibiotics and was okay. But because of that incident, this was on her mind. She started wondering if her pain was more than maybe just cramps. So, question, how often is appendicitis misdiagnosed as just a woman maybe having cramps, getting her period?
Yeah, it's even in her son's situation, we were doing this over the phone, which makes it tricky. But fortunately, I could describe exactly to Gemma how to examine her son and give me the answers that helped me figure out it probably was appendicitis. And then luckily, she was at a hotel close enough to a hospital where we could get a scan. And then once I could tell that on the scan, it did appear early and there weren't the significant risk factors, fortunately, we were able to give him antibiotics and get him through till he could get back to the United States. Because if he had to have surgery there, that would have been the rest of their vacation, just staying there as opposed to their plans. How often does this get missed? It is easy to miss appendicitis because, especially in the early stages of it, because there are so many other things it can be. And so you do have to be careful. You have to be on the lookout. And most often we see it in kids age 10 up to adults age 30. So although we can see it at any age, and so sometimes if you're older, we might not have as much heightened awareness to it, and we might be thinking other things when it still can be appendicitis. And so, yes, it can get missed, and sometimes you're right. A woman might mistake it initially for maybe they're having menstrual cramps. But the clues are, first of all, is it the right time for your period, especially in those women that are very regular? If this is occurring a week or more off of your cycle and you've been pretty regular, then we got to worry about things like appendicitis, and there's other things as well. The other thing is that even for those women that have fairly painful, uncomfortable menses, if you're having the pain and you haven't started your period, that should be a warning sign. If you're having the pain and you've got fever, that should be a warning sign because although some women can get very low grade fevers with their menses, most don't, and so that could be a warning sign. And then other things that can be warning signs: if you're also getting nausea and vomiting, and that's not characteristic of your menstrual period, then that should heighten awareness. And a lot of times people with appendicitis will just completely lose their appetite. And so so basically, if you're seeing anything that is not real typical of your period, you need to think it could be something else and let a doctor know so we can check it out.
You mentioned that this can be dangerous, and I'm curious as to how dangerous. Gemma got wheeled back into the ER pretty fast. It was at night. It was on a Sunday. So it sounds like it's something you shouldn't mess around with. What happens if you don't get in there in time and your appendix actually bursts? What happens then?
So when the appendix bursts, what happens is the fecal contents, the things that are inside your bowel that we would like to keep inside your bowel, instead, when your appendix bursts, it's now like you've popped a hole in the balloon. And now instead of the air leaking out, all those fecal contents can leak out into the whole area of your abdomen. And that those fecal contents are loaded with bacteria. So now you get an infection that is potentially life-threatening. It's called peritonitis, and that we're not going to miss. The signs are extremely obvious to both patient and doctor. I've never seen a case of that missed. We'll know, but we want to treat before then, because once it's gotten in there, then we can't do the laparoscopic surgery where we just put a little, few tiny nicks and a big tube in and cut out the appendix. We have to open you up, and then we have to go in and clean things out. And now you're at much more risk of complications following it, including adhesions and things. But if that infection can't be contained and it gets into your blood, people develop very life-threatening infections. So it's nothing to mess around with.
I actually had a family member who had this happen, and it burst, and they went in, like you said, cleaned it up, closed everything up, and it's not like cleaning your sink. There's a lot in there, and stuff can hide, and some stuff that shouldn't have been in there was still in there, and so he got sick, and they had to open him up again. It's not a pretty process. It's very scary.
No, and that's not a rare event that you might not get everything out and then might have to go back in. Or more commonly now, we can put in a needle under ultrasound guidance and try to get the pus out and so forth. But it's not fun, and it means instead of having the laparoscopic surgery, which we can usually send people home the next day, you're going to be in the hospital, very likely more than a week for treatment if it gets to the point of peritonitis.
And like you said, plenty of more complications. You got to have lots of antibiotics. You're going to have, like you said, adhesions. It's just not a pretty thing.
And a much longer recovery time.
Absolutely. Got some of your questions ready here for you. And Dr. Pate, I want to start with Rosie from Meridian. We got these in just right before the show, and I gotta tell everybody before we go any further, Dr. Pate doesn't always get to see the questions ahead of time, and sometimes we're just calling on his amazing brain to be able to answer all of these sometimes very technical questions. We try to give him a heads up, but it doesn't always work. So kudos to you, Dr. Pate, for hanging with us and being able to cover almost anything. I'm impressed.
Well, and thank you for increasing my anxiety levels.
Anytime. Okay, Rosie from Meridian, she's 75 years old. She says she's had all the COVID vaccines available up to this point. She says, I did get COVID in 2022, but feel the vaccines have helped prevent any other repeat infections. She wants to know about COVID vaccines going forward. Basically, will we keep getting new vaccines this year, in the future? Is this going to be like the flu vaccines now? She also says she reads your blog, Dr. Pate, and, quote, am so very appreciative of the information you provide.
Well, Rosie, thanks for making my day. So I appreciate that. And it's a great question. And there's actually a lot of misconception about this. So your question gives me an opportunity to tell you about a recent study. Okay. And so, first of all, Rosie, part of your question is that you've been up to date, getting all the vaccine updates as they come available. And to your knowledge, only had COVID several years ago and feel like maybe this has prevented it. Now, the common mantra among people is that the vaccines will not protect against infection, that it only protects against severe disease. And it certainly does protect against severe disease. But this interesting study that came out showed that if you've been getting the updates all along, and so you've gotten all these vaccines, that you do get to a point where you start to develop what's called mucosal immunity. Now, that doesn't mean you can't get infected, and so I would not throw caution to the wind. But what it means is that actually getting these repeat boosters and new vaccines does appear to give you some protection, and we still see that in the data that rolls out. So I wasn't shocked about this, but there is some protection. And you're right that I suspect you also use good common sense and other measures to protect you, but the vaccines no doubt are helping you. So then the other part of your question is, what do you need to do going forward? What can you expect? Well, the new formulation for the fall booster that will come out later this year has been recommended through the FDA, and I am not quite sure if the CDC signed off on it yet, but I suspect they have. So yes, we should be expecting a fall booster. If you, given it at your age, you're entitled to 2 shots per year. If you haven't gotten your mid-year shot, now is the time to do it. I just got mine last week, and especially so because some of these lots of vaccine are, this will be the last month they're good for. So if you don't get it now, you may have to wait until the fall booster comes out. But yes, at this point, it does appear you're going to have to keep getting shots. Now, on the other hand, there has been some really promising research, and we may have an upcoming nasal vaccine that could be much more protective and easier to take, but that's a ways off from getting approved yet.
Well, I think it's fascinating when we're talking about this, like it's going to be a flu shot or even combined with the flu shot. It's this is just something that's become part of our culture, I think.
Yeah, and part of it is because both of these viruses change so frequently. That's why you kind of have to keep getting a new flu shot every year, and why we keep coming out with new COVID ones is because the virus is able to mutate and change very quickly, and so we have to keep up with that.
We also got an email from Sheila in the Wood River Valley who wanted to say thank you to both you and Gemma. And she said, quote, Gemma and Dr. Pate got me through the pandemic with your clear and truthful information about the virus. It's not really a question. I can't tell you how many emails we get, whether it's a question or not, that are so appreciative of what you do every Wednesday with us, Dr. Pate. And we should reminisce a little bit. You have been doing this for quite a while with us.
Yes.
Unpaid, I might add. Dr. Pate does not get paid. We actually steal his time every Wednesday. It has been quite a ride. I can't thank you enough for what you've done for us.
Well, thank you. And I'll tell you what, these listener thank yous just mean the world to me because, as you say, it is a sacrifice of my time to do it. And I usually am looking into a screen and not knowing if there's like only one or two people listening to me. But I have been very humbled. I just run into people all the time who tell me they listen to the show every Wednesday and how important it's been to them. And it just means the world. So thank you for writing in with that note of appreciation.
We've got another question. This is from Sue. She wrote in, my doctor told me anyone who got the measles vaccine from 1963 to 67 got an ineffective dose and needed to get a booster, which she did. She wants to know, do I need 2 doses? We kind of looked at this a little bit. We've talked a little bit about the measles vaccine from early on to where it is today in past shows, but she's also worried. She asked around, none of her friends are being told that they need to get this vaccine, especially if they're her age. So the question is, can you clarify one more time about if you got a vaccine in the 60s, should you get one now? And then she wants to know, is this information getting out to older patients? Is this something on the doctor's radar to tell their older patients you might want to, get another measles vaccine?
Yeah, as far as the last part of the question, I'm not sure how widely known this is by physicians. Certainly, we have tried to get that information out. And what the issue is that the vaccine during those years that you mentioned was an earlier form that used killed virus. In other words, it was virus that could not replicate or reproduce. And what was determined, while that kind of vaccine is good for a lot of other infections, it just didn't result in the robust immune response that we get from using the live attenuated vaccine. And that's why those vaccines were withdrawn. I think it was 1968, if my memory serves me. And so anybody that got vaccinated after that would have gotten the really effective one, the MMR. Also, a lot of doctors that were caring for these children, after that vaccine was withdrawn, they went ahead and gave them MMR. So a lot of those people are still protected. But if it's a case like yours where you only got that vaccine and did not get, the doctors were quite right to give you a dose of the MMR. And for most people, that one dose of MMR will be plenty for you. Now, there are some nuances to this. There are some cases where we would recommend a second, not to most people. So do check with your doctor if you think you're not kind of an ordinary healthy person, but might have some medical issues that need to be considered, because it is possible that you might be given a second dose. But for most people, if they got that killed vaccine, they only need one dose of the MMR and they're going to be fine.
Dr. Pate, I have a question this week, so I get to be a listener question. So right now, I am pouring a cup of tea. And I did a little research on my tea, and this particular tea has about 15 milligrams of caffeine. This will become important later, so stay with me. My question comes out of a story I read. It's a 28-year-old Florida woman who was healthy. She worked out on a regular basis, so a lot of exercise, ate organic foods, and had a massive heart attack and eventually died. Now, her mother is blaming her death on her daughter taking caffeine supplements, drinking up to 3 energy drinks every day, and drinking a lot of cups of coffee. So let's dig into this. Energy drinks, what's in them, and are they bad for you?
Well, they can be. First of all, depending on where you're getting, particularly on the supplements, we may not know exactly what all's in there. They're not as closely regulated. On the energy drinks, they tend to have a lot of caffeine. So you mentioned the 15 milligrams in your tea. So let me give your listeners kind of a framework to figure out, well, is that a little or a lot?
Yeah.
If you looked at adults, 85% of adults consume on the average 135 milligrams of caffeine per day. So 135 is kind of the average. Now, what the FDA says is the maximum of caffeine you should have in a day is 400 milligrams if you're an adult. Now, if you're an adolescent, and that I worry about young people, because I remember what it felt like to feel like I was invincible, and they're taking all these energy drinks and they're not thinking about any risk. For adolescents, the FDA says the maximum is 100 milligrams. So you said there was 15 milligrams in your tea, so that's not a whole lot.
Hey.
But let's look at, let's take some energy drinks.
Okay.
So Red Bull and Monster, if you had about a 16 ounce, one of those cans, you'd be getting 160 milligrams. So you'd be more than, if it's just that one can, that would be more than average for an adult, but you'd still be within the 400 milligram limit. However, if you use some energy drinks that I hadn't even heard of, but being old, there's a lot of things I haven't heard of the kids are doing these days, but Bang energy drink for 16 ounces, that's 300 milligrams.
Oh my gosh.
So right there, that's almost the max there. Celsius Heal is, if it's 12 ounces, you're getting 300 milligrams. And Rockstar Endurance, the 16 ounce would be 300 milligrams. So you can get a lot in one can. And of course, the story that you teed this up on, that really sad, tragic death of that young lady, her mom may be very well right, because what I understand is that she was drinking 2 or 3 cans of energy drink. So we see how you could get up pretty high there, plus drinking coffee. And I was a little shocked. I just looked up a Starbucks, the Venti, which is 20 ounces, like the Pikes Peak. That's like almost 400 milligrams right there.
Oh, wow.
I mean, that's all you could have for the whole day in terms of the maximum recommended. So there can be a lot in coffee, and depending on how it's prepared. And apparently she was drinking both coffee and these energy drinks. And then we haven't even added in the energy supplements, which really, I don't think you can always count on what's on the label, because it may or may not be accurate. And so, yes, you could certainly get into danger by drinking a lot of coffee and these other supplements and energy drinks.
Well, let's talk about those little supplements. They're like little energy shots. They come in these little bottles of liquid. You can get them anywhere. I see them a lot at the gas stations and stuff. And I see people just, grab 2 or 3 and take them. And, it's supposed to give you that energy boost, whether it's got caffeine or they often promote B vitamins in them. But what else is in this stuff? I read about something called taurine that some researchers are worried about. As you said, there are other things in here. We may not know what they are because they're not as well regulated. And some of the things that are in there, maybe we shouldn't be taking.
Yeah, so taurine is an amino acid, and it's amino acids are kind of the building blocks of proteins, and taurine. Our bodies make plenty of taurine. The only time we have to worry about maybe not getting enough taurine is little infants, but they get it through the mother's breast milk. Or through supplemented formula. So adults don't need to be worried about being low on taurine. The reason they throw taurine in there is there's certainly a belief that will help their muscle metabolism and so forth. And that could be, but we just really don't know. It hasn't been studied a lot, and some of the other ingredients have not been studied at all. So you do have to be careful. Caffeine, what happens, and especially was the case in this young lady's case, who was, what some of us old folks would call a gym rat, going to the gym all the time and all. And a lot of people do take these caffeine supplements or drinks because caffeine in reasonable amounts will increase your exercise endurance, your speed, it will lessen fatigue. And so they commonly believe they'll get a better workout with it. The problem is if you are really working out hard and you're also taking a lot of caffeine and supplements, that's where you can get into heart problems because the caffeine also increases your heart rate, which exercise already does. It increases your respiratory rate, which exercise already does, and it increases your blood pressure, which exercise already does. So if there's any underlying abnormality or genetic predisposition or any number of issues, we could see heart attacks, arrhythmias, strokes, various things that are not good that can happen. So this is one of those cases that if a little is good, a lot more is not better.
Well, so I saw that the American College of Cardiology says, like you said, having too much of these drinks and supplements all at once can have side effects. You mentioned several of them. I saw somewhere about it can maybe shrink your blood vessels a little bit. And I was always told, if you have a headache, you should drink caffeine because, it'll help shrink up those blood vessels and make your headache better. So, but that can be a bad thing, especially when we're talking about heart and the valves that go in and out of that.
Well, that's right. So it is correct that some people with headache disorders, especially headaches that are caused by what we call vasodilation, where the blood vessels dilate and they get these throbbing headaches, they may actually feel better with caffeine because it tends to vasoconstrict or narrow those blood vessels. So that is true. However, if you're not one of those people and you are getting jittery, your hands are shaking, you're agitated, your heart is racing, you're getting a headache, any or all of those signs are evidence that you're taking too much caffeine and that it can be a problem. So again, under the right amounts, right circumstances, caffeine can actually be good for you. There's some health benefits to it, but you can easily go overboard and now it's just health detriments and not health benefits.
Right. And as you said, it's hard. It can be hard to keep track. I got to tell you, I had a colleague I used to work with here at the radio station. I will not say who he was. And he used to pop caffeine pills to stay awake when he was working late or whatever. And he had a big bottle of them on his desk. And he would take these like candy. And, it's a little scary when you think about that. And then you think about as you said, the energy drinks and the supplements that you may not know how much is in there. And if you drink 2 or 3 or more a day, that can be very dangerous.
Yeah, you do have to be careful. Now, look, if someone tried to take me off of coffee, I mean, my wife would divorce me and I would go nuts. So I have to have my coffee, but you have to know when enough is enough. And what is really concerning is when you're adding all these other things because you're not keeping track of it. It's all adding up, and you may not even know how much you're getting. And certainly in my medical training, there was often in times, I was up awake for 36 hours at a time, which is not recommended to any normal person, but that's what we had to do back then. And sure enough, I would drink coffee. But for other people that are drinking coffee at night to keep from going to sleep, college students, others, you really have to think twice about it because not only are you risking too much caffeine, but now you're not getting the sleep that your body needs to heal itself and to perform well the next day. And so you might be getting a short-term gain, but a longer-term loss. So you just have to be very careful about managing this.
Absolutely. And if you're a parent, as you said, this can be more dangerous for kids. Maybe look at that can of whatever they're drinking and see if it's one of those that has already 400 milligrams of caffeine and figure
Oh,
out.
yeah.
Yeah.
I did not let my kids drink energy drinks, and I would do my best to keep my grandkids from drinking them. I just don't think that's what they need. I think kids have a lot of energy. Normally, let them go out and play, then make sure they're getting a good night's rest. Don't load them up on energy drinks, that kind of thing.
Always good advice. Dr. Pate, again, I want to thank you, especially for all you've done over the years and all you'll do in the future years as we continue on. It has been so wonderful. I've learned so much every time I get a chance to talk to you or listen to you. I think it's fascinating. So thank you again.
Thank you, Samantha. And I want to tell the listeners, Samantha, Hannah, Gemma, the whole team, they're outstanding. And I do want to make my own plug. Thank you to St. Luke's for supporting this show, but thank you to the listeners that are supporting the show. And please do contribute. It really helps the show. I don't get a penny of it. I don't need a penny of it. But the important thing is that we have the show go on. So please donate to Boise State Public Radio.
Well, that's a great pitch. Dr. Pate, thank you. You will be back next week, and we will see you then. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System, and the co-author of the book, Preparing for the Next Global Outbreak. It's really good. If you have a COVID-19 question or any other health question, give us an email, idahomatters@boisestate.edu. We'll answer it next week.
This is the Idaho Matters podcast. I'm Gemma Gaudet.